Kim, welcome back.
Thank you.
It's been a little bit since I've seen you. Just to recap, we had, you were diagnosed with Meniere's?
Yes.
Okay, and so you came down here originally seeking symptoms from, I would imagine, the big four with Meniere's being the hearing loss, the vertigo, the tinnitus in the ears, the ringing in the ears, and oh goodness,
The ear fullness.
the fullness in the ears. Yes, thank you. And so when we got you here, and before we treated you, we actually noted that you had 17 symptoms, and the inner ear was your focus, but you had other things going on. And then we've got you down to 5, and this is dated January of this year. So what I'd like for you to do is just tell me what's gone on since January when we last evaluated symptoms for you.
Okay, since January, I have just had a really slow, steady improvement in my symptoms. Prior to that, there were some fluctuations in my hearing and tinnitus and ear fullness and vertigo. And since January, I have just had this really slow, gradual improvement. About 6 weeks ago, I stopped wearing my hearing aid. I haven't had a hearing test in about 2 months, but I am sure my hearing has improved almost to normal. In January, when I had my hearing test, I was in the moderate to severe range for hearing loss in my left ear. So,
Left ear, okay.
yeah, just in the left ear.
All right.
So that has been a huge improvement. I no longer have the disruptive tinnitus. When my hearing would drop, I would get a tinnitus that almost sounded like a jet engine in my left ear. It was very disruptive to my life. It was hard to focus on anything.
Yeah, right.
So now I do still have a little bit of tinnitus, but it is my little kind of crickets that they can be annoying at times, but overall it's livable, very much livable.
What about the vertigo?
I have not had any vertigo since January.
Okay, that's a crazy improvement that you're talking about.
Definitely.
Considering that we're not giving you medication, we're not doing surgery.
No.
All we're doing is managing the bite.
Absolutely.
Okay. Have you talked back to the ENT that gave you the original diagnosis of Meniere's?
I haven't seen him since January, so I haven't discussed my improvements with him. But yeah, I guess I don't want to revisit that part of my life, so I'm avoiding him. Right now.
I get it. Well, just on the offshoot, just a little side note, I don't have a problem sending a letter if you want me to, just saying, hey, by the way, these are I'll send the copies of these are her symptoms. These are the symptoms now, and so docs, I would be appalled if I missed something, and well, how do I not miss that again? But most doctors will say, well, it can go into spontaneous remission, which, by the way, TMD does the same thing. It'll go into spontaneous remission in some cases, but it always seems to come back. So again, I totally get hey, I don't want to revisit that part of my life, and the other part is I don't want to jinx anything, let's just keep moving forward exactly how we've been going, the slow, steady improvement, which I've heard from a great many patients. Not everybody who I do this on wants to be, a YouTube video for other patients, but one woman did, and even a year afterwards, she's like, I can't believe it's a year and I'm still noticing things are slowly but steadily just getting better. And so even the way you phrase that is the exact same way that I've heard it in other ways, in other patients. So are you glad you had it done?
Absolutely. I would do it again. I would recommend it to anyone.
Okay.
When I was diagnosed and dealing with my symptoms, I would do anything to have an improvement. And I'm so thankful that I found this.
Well,
Because a year ago, I was in the darkest place in my life. The symptoms sent me into a depression that I had never knew I could be in. And so looking back now, I didn't even realize how bad off I was until now that I feel better. It's awesome. So I'm very happy.
It's a kick in the pants to be the provider and to be helping patients on the level that you're talking about. Not everybody gets that, And so I think when we were a couple of months into it, you were starting to doubt, am I going to get there?
Mm-hmm.
Yeah, am I going to hit that goal?
Right.
And that's the reason why I have to be just upfront and honest and say, this may take us a year.
Mm-hmm.
And so we have to just be patient, let the body does what she does and rebound.
Yes.
So perfect. Well, I appreciate you allowing me to be a part of your journey, and I'm glad you're having the results that you are. And, just know that if symptoms start, if you have a bad stretch of 2 or 3 days, that might be a norm for you randomly throughout the year. If you start getting into like 7, 10, 15 days and you can't shake it, it doesn't go back to normal, whatever that is for you, you might want to come back and let me just touch it up and check it, because a lot of times patients have been dealing things for 15 years and it's only been the last 5 that they've had symptoms. So when the body starts to unwind even more, you're like, wait a minute, I thought that part of my life was over. We might need to do a touch up. And I've seen that in a handful of patients. It's like 3 to 5% of patients might need a touch up afterwards. But just kind of, don't panic. Just know that, okay, I just need to call him and make an appointment and get down there and let's check it, okay?
Absolutely.
Okay, perfect.